Each year, countless seniors prioritize their health by scheduling regular checkups, which is a wonderful habit. However, have you ever considered that some routine tests might present unforeseen challenges to your well-being? It's a gentle thought to pause on. You place great faith in your medical team and diligently follow their guidance. Yet, within the complexities of healthcare, there are considerations worth knowing that aren't always part of the main conversation. This information may not be on the evening news, in clinic pamphlets, or even top of mind during a busy appointment. Picture this. You leave your checkup feeling reassured, but a few days later, you notice a bit of unsteadiness or fuzzy vision. It's natural to wonder about the cause. The reality is, certain diagnostic procedures, particularly if repeated often or with specific underlying health factors, can sometimes cause temporary changes in blood pressure or circulation that are worth being aware of. Please know, the purpose of this discussion is not to cause concern, but to empower you. It's about helping you have more informed conversations with your doctor to safeguard your health. In our golden years, proactive health management isn't only about detecting issues, it's also about thoughtfully considering the path we take to get there. In this video, we'll gently explore 5 common medical tests that have some special considerations for seniors. We will also share simple, positive steps you can take to partner with your doctor before your next visit. If you're enjoying your vibrant years over 60, we'd love to see a friendly hello in the comments, and we invite you to subscribe to Health 365, where we share insights for your well-being journey. Let's begin with our first topic, a procedure you may be familiar with. If you've had a CT scan with a contrast agent, you might recall a brief warming sensation. This is the contrast solution working as intended, helping to create a clearer picture of your body's blood vessels, organs, and tissues for your doctor. It sounds quite beneficial, doesn't it? But here is a gentle note of caution for seniors. That small injection is designed to improve the imaging, but it can also ask a little extra from your circulatory system. This is an important consideration if you're over 60 and managing conditions like blood pressure, heart health, or kidney function. For a small number of individuals, the contrast agent can cause a vasovagal response, which is a brief dip in heart rate and blood pressure that might lead to feeling dizzy or faint. For others, the opposite can occur. A temporary increase in blood pressure may cause blood vessels to constrict. In these moments, it's wise to be mindful of your cardiovascular health. A study in the Journal of Vascular and Interventional Radiology noted that older adults, especially those with existing hypertension, cardiovascular conditions, or reduced kidney function, saw a higher incidence of vascular events within 3 days of a contrast-enhanced CT scan. This simply highlights that the more health factors you're managing, the more important it is to be mindful of contrast agents. Let me share a relatable story. An 81-year-old gentleman named Arthur had a standard abdominal CT scan for some mild indigestion. His results were clear, and he went home feeling well. 2 days later, however, he experienced a minor stroke. His doctors felt the contrast agent might have briefly elevated his blood pressure, which may have contributed to a small clot affecting blood flow in his brain. This absolutely does not imply that CT scans with contrast are unhelpful. They are vital, life-saving tools for identifying serious conditions like cancer, blood clots, and aneurysms. The key message is about personalization. These powerful scans are best used when medically necessary rather than as a just-in-case part of a routine exam. So, what can you do to be proactive? When a CT with contrast is suggested, you can ask your doctor, is this scan essential for my diagnosis, or could another option be suitable for my age and health profile? Always provide a complete health overview, mentioning any history of high blood pressure, kidney or heart conditions, or past reactions to contrast. A simple question like, could we get the images we need without contrast? Is always appropriate. Sometimes a non-contrast scan or an ultrasound can offer sufficient information with fewer variables. Next, we'll look at a common screening that many seniors undergo, even when feeling their best, which may have some nuances worth considering. Let's discuss the exercise stress test. In theory, it seems like a very sensible idea. You walk on a treadmill while connected to a heart monitor to see how your heart responds to exertion. For many, it is. But for those over 60 with certain health conditions, it's a test to approach with awareness. Here's the reason for this. During the procedure, you're encouraged to walk or lightly jog as the treadmill's pace increases. This causes your heart rate and blood pressure to rise, placing your cardiovascular system under a controlled but significant workload. For a young, healthy person, this is typically manageable. For seniors managing other health factors, it's a situation that calls for careful consideration to avoid potential complications. Some of these considerations include pronounced spikes in blood pressure or the onset of arrhythmias, irregular heartbeats. In very rare instances, the strain could affect delicate blood vessels, including those in the brain. A 2020 study in the American Journal of Cardiology involving over 1,300 individuals older than 65 found that nearly 7% had notable events like blood pressure surges or rhythm changes during the test. The group most frequently affected were those with known vascular conditions. This is more than just data. It touches real lives. A community member, Eleanor from Vermont, shared her experience. At 74, she has managed high blood pressure for some time. Her physician suggested a routine stress test. Partway through, she felt lightheaded and a tightness in her chest. The test was stopped right away, but the following day she had a minor stroke. Her medical team believed the sharp rise in blood pressure during the test may have impacted a small vessel in her brain. To be perfectly clear, the test was a contributing factor, not a direct cause. It introduced a significant challenge to a system that was already managing other health concerns. So, what's the empowering takeaway? Have a conversation with your doctor. Ask, what is the most gentle way to assess my heart health? Often, a nuclear stress test, which uses medication to gently simulate exercise, or a resting echocardiogram can be more suitable options. If you are not experiencing any new symptoms, it is also reasonable to ask if the test is needed at this moment. In our next section, we'll explore another common procedure that seems straightforward but carries considerations, especially if you're taking certain medications. Let's talk about a very routine procedure for those over 60, the endoscopy. Whether for examining the esophagus, stomach, or colon, it's often recommended as a precautionary measure. While this is often appropriate, it's useful to know that if the procedure isn't strictly necessary and involves sedation, there are factors to consider. To begin, a majority of people in their golden years take one or more daily medications. Blood-thinning medications such as warfarin, aspirin, or Plavix are quite common. During a sedated endoscopy, your blood pressure and circulation can shift. When you combine this with medications designed to prevent clotting, the potential for internal bleeding or changes in brain circulation, which could lead to a silent stroke, becomes a topic for careful discussion. A major 2021 review in the journal Gastrointestinal Endoscopy showed that among patients over 65 who had sedated endoscopies, there was a noticeable increase in transient ischemic attacks, TIAS, often called mini-strokes, in the 3 days that followed. While not full strokes, they served as indicators that the brain's blood supply had been temporarily interrupted. One personal story that stayed with me was that of a 76-year-old woman who underwent a routine colonoscopy with sedation. She felt perfectly fine beforehand, but 2 days later, she noticed some slurring in her speech and felt uncoordinated. A trip to the hospital confirmed a mild stroke. Her doctors reasoned that the temporary drop in blood pressure from sedation combined with her daily aspirin might have created an environment where a small clot could form and travel. Even with a low-risk procedure, the interplay of sedation, age, and medication can create a complex situation. This certainly doesn't mean endoscopies should be avoided. It simply means it's wise to agree to one after your doctor clearly explains its necessity for your current health situation. If it's being suggested simply because some time has passed, it's fair to ask if there are other, non-invasive ways to monitor your health, especially if you feel well. Always give your doctor a complete list of your medications. Ask them, should I pause my blood thinner for this? What are the specific considerations for sedation at my age? If you have reservations about sedation, inquire if the procedure can be performed with a lighter alternative or none at all. Next, let's turn to a different kind of test, one that involves an organ many of us don't always think about in this context: our kidneys. MRIs are remarkable diagnostic tools. They allow doctors a clear view deep inside the body, helping them find issues early and sometimes preventing the need for surgery. However, when a contrast agent is used to enhance the images, it's a moment for careful thought, particularly for older adults or anyone with even slight kidney concerns. The contrast solution in MRIs often includes gadolinium, a type of heavy metal. In a healthy system, it's designed to be filtered out by the kidneys. The important point here is that after age 60, kidney function can naturally become less efficient. If you have undiagnosed chronic kidney disease or reduced function, your body might not clear the gadolinium as quickly as expected. Over time, trace amounts could remain in the body. This lingering can be a concern. Gadolinium retention is associated with a rare but recognized condition known as nephrogenic systemic fibrosis, NSF, which involves the hardening of skin and connective tissues and can affect mobility and organ function in serious cases. But here's a less discussed aspect. Trace amounts of gadolinium have also been detected in brain tissue. Some researchers are exploring whether this might be linked to subtle neurological effects like confusion or dizziness, especially in individuals with existing circulatory conditions. A 2019 study in radiology followed over 2,000 patients older than 65 who had contrast MRIs. About 5% mentioned stroke-like symptoms like headaches or balance issues within a week, with most of these individuals having underlying kidney issues, some previously undiagnosed. Arthur, a 79-year-old veteran from Florida, had an MRI for persistent back pain. His doctor included contrast for a more detailed look. Arthur wasn't aware his kidney function was diminished. 2 days later, he felt faint, weak, and mentally unclear, feelings that lasted for about a week. It was only when his family doctor did blood work that they found he had stage 3 kidney disease. "No one mentioned this possibility," he shared with us. "If I had known, I would have brought it up." So, here is your takeaway. If a contrast MRI is suggested, feel empowered to ask, can we obtain the necessary information without contrast? The answer is often yes. If contrast is deemed essential, you can request a simple kidney function blood test called a GFR beforehand for everyone's peace of mind. It's also helpful to let your medical team know about any unusual reactions you've had to imaging tests before. Remember, the MRI machine itself is not the issue. It's the added substance that your body might handle differently. With a few proactive steps, you can get the diagnostic answers you need while protecting your brain and kidney health. Next, let's discuss a test that seems very safe but might lead older adults toward procedures that warrant a second thought. The routine carotid artery ultrasound. It's a simple, non-invasive scan of the neck arteries that is quick and involves no needles or dyes. It seems like an ideal preventive screening, and it can be. However, for seniors without any symptoms, it's worth understanding how this test is used. Sometimes, this simple scan can start a conversation about surgeries that may not be immediately necessary. The carotid arteries are the primary channels supplying blood to the brain. With age, it's common for plaque, composed of cholesterol or calcium, to build up in these vessels, just as it can elsewhere in the body. This is a normal part of aging. However, not all plaque requires surgical intervention. In many situations, careful monitoring is a safer approach than an operation. Here is where the path can diverge. Imagine the test reveals some arterial narrowing, perhaps 50% or 60%. That number can sound concerning. Your doctor might then refer you to a vascular surgeon, and soon you may be discussing a carotid endarterectomy or a stent. However, if you have no related symptoms, like dizziness or vision problems, these procedures might not offer significant benefits and do come with their own set of risks. A landmark study in the New England Journal of Medicine tracked over 3,000 asymptomatic seniors with moderate carotid narrowing. The researchers concluded that for many, managing the condition with medication and healthy habits was just as effective at reducing stroke risk as surgery. More importantly, a small fraction of the patients who chose surgery experienced a stroke as a complication of the procedure itself. A story that truly illustrates this point is that of Dorothy, 82, from Michigan. She felt great at her checkup, but a routine carotid ultrasound was done to be thorough. It revealed 65% narrowing, and she was scheduled for surgery shortly after. Regrettably, she had a small stroke during the operation. She recovered, but now has some weakness on her right side. Her reflection was, "I wish I had understood that careful waiting might have been a better choice for me." So, what is the best approach? If your doctor suggests a carotid ultrasound and you feel well, you can ask, what are we hoping to learn? And how will the results guide my care? It's important to know if the scan will genuinely alter your treatment plan or just add a layer of worry. If you are already taking medications for blood pressure and cholesterol and leading a heart-healthy life, more tests might not change your daily regimen. If a scan has already shown some narrowing, take a calm breath. Inquire about follow-up scans to monitor the situation rather than moving directly to surgery, and it is always wise to seek a second opinion before committing to any vascular procedure. Let's conclude with some warm encouragement and a gentle reminder that you are the most important member of your healthcare team. The key takeaway is this: not every test poses a risk, but not every test is beneficial for everyone, especially after 60. Our bodies have unique histories and respond in different ways. A procedure that seems standard, like one involving a contrast agent or a sedative, can create effects we might not anticipate. A simple injection could cause a temporary blood pressure change. A scan could lead to an unexpected reaction. Even a standard checkup has nuances when our bodies are already managing other conditions. This is why it is so valuable to take a moment, ask thoughtful questions, and ensure every test is tailored to your specific health needs, not just a standard protocol. You have the power to be an active partner in your care. It is perfectly okay to ask, is this truly necessary for me right now? And to say, could we explore a gentler alternative? Informed choices are the foundation of positive health outcomes and give you a wonderful sense of peace. Your personal health journey is important. Your voice has value. Our philosophy here is that every health decision should be rooted in clear knowledge and partnership, not in anxiety or routine. If you've ever had an unusual experience after a medical test or supported a loved one through one, please feel free to share a 1 in the comments. If not, a 0 is fine. This is a space to connect and learn from each other. And if this conversation has helped you feel more informed, confident, or simply more curious about your health, we hope you'll subscribe to Health 365. We are dedicated to sharing clear insights, encouraging thoughtful questions, and always prioritizing your well-being first and foremost.